For the first trimester of pregnancy. It's a really special time. So the number one thing I've always been drawn to is compassion meditation for both myself and my baby. And it's lovely to notice how much you start to care for yourself in a different way. So starting to practice self-compassion, really learning to give a sense of tender care to yourself is really nice. And remember to start to massage gently through the breasts and the belly to prevent any stretch marks later on. So you can use special oils to do that, and just massaging very softly and gently without pressing on any mama points. Particularly avoid massage around the head and neck. Some other modifications in yoga that you might look at are making sure that you're not doing breath of fire, or Kapalabhati or skull shining breath. So no fast breathing, rapid breathing. All of that's negated. And we're looking at focusing on increasing parasympathetic nervous system activity and the relaxation response for you, because stress really affects your biome and affects your genome, and maternal stress is passed down through the bloodstream and the genome and the biome to the child. So keeping you as stress-free as possible is really important. So your out breath is really crucial. So you can bring movements into your practice with a focus on a longer exhale to bring down the sympathetic nervous system activity and increase parasympathetic nervous system activity. So that means that when we move, we're moving with the out breath, and we're putting the hands or the movement into the out breath. Okay, so you can do this, of course, with any movement. Inhaling, exhaling, longer exhalation. Look at a 60% exhalation to 40% inhalation. Again, with any movements, inhaling, exhaling, longer exhale all the time. Keep the movements nice and flowing. There's nothing that you need to force at this time. You can still put a little bit of weight on the belly, but you might start to feel that starting to become a bit of a hindrance to your practices and possibly to your baby. So definitely after the first trimester, no weight on the belly. Avoid twisting after the first trimester, but in the first trimester, there's no harm in twisting, and I actually find that moving into what we call samana vayu, and although I don't have any science to support this, but moving into this energy that cares for digestion with a long out breath can often help nausea. So see how you feel about it, but just exhale, gentle twist, and breathing out. Okay, it's really great if you're practicing for an active birth that you get strength through the legs and hips. So all throughout each trimester, I recommend that you do practice squatting and postures that start to make the legs really strong. Most of all, again, come back to that compassion meditation for yourself and enjoy this time, even though it's a difficult time for some with the nausea. Try and get some rest and recuperation.